Hello, everybody, and good afternoon. This is Nurse Eunice with Florida Training Academy. In today's video, we're going to be reviewing 20 multiple choice practice exam questions for those who are either CNAs or patient care techs who work on the medical surgical units in the hospitals. And so we'll give you about 10 seconds to get your notifications and to join our practice exam. If this is your first time here, please put your name and wherever you are tuning in from in the comment area. Don't forget to get pen and paper so that you can take notes, and also put your answers or your questions in the comment box. And we're going to get started in a few moments. And hello, everybody. Right. Number one, a postoperative patient has an order for strict intake and output, INO monitoring. What is the primary reason for this order? Is it A, to ensure the patient is consuming enough fluids, B, to monitor kidney function and fluid balance, C, to prevent the patient from becoming constipated, or D, to encourage the patient to drink more water? All right, and I'm thinking I'm seeing some correct responses coming through. I see A's, I see B's. And so the correct response, the reason why we adhere to strict intake and output monitoring, the correct response is B. So great job, to monitor kidney function and fluid balance. So postoperative patients are closely monitored for fluid balance to ensure proper kidney function and to detect any signs of complications such as fluid overload or dehydration. Question number two, you notice a post-operative patient's urine output has decreased significantly over the last 4 hours. What is your first action? A, increase the patient's fluid intake. B, report the finding to the nurse immediately. C, document the output and continue to monitor. D, check the patient's catheter for kinks. And yes, that is correct. So, whenever someone's urine has decreased significantly in 4 hours, there are some things you can resolve by checking for kinks, but because this patient is post-operative, I need for you to do B. I need you to be thinking that there's a possibility that this could be a complication from their surgery, such as kidney failure or fluid imbalances, and this needs the immediate attention of a nurse or a doctor. So, of course, for your CNA and your PCTs, you will be notifying the nurse, and the nurse would then relay that information to the doctor. Our next question. Question number 3. A patient has an order for vital signs to be taken every 4 hours post-operatively. Why is this frequency important? A, to ensure the patient is not developing an infection. B, to help the patient feel more comfortable. C, to make sure the patient is awake and alert. D, to assess the patient's pain levels regularly. I see a lot of A's, and I am so proud of you. Yes. So it is A, to ensure the patient is not developing an infection. So frequent monitoring of vital signs helps in early detection of postoperative complications, such as infections, which can be indicated by fever and changes in the heart rate or blood pressure. You all are doing excellent. Number 4, what dietary component is essential for wound healing? Is it carbohydrates, fats, proteins, or sugars? Karen says C. Anna says C. Knowledge says C. Great job, everybody. Yes. Proteins are crucial for tissue repair and regeneration, making them essential for wound healing. So, if your patient's not going to eat meat, if they're not going to eat their legumes or their beans, the nurse can speak with the doctor and get a protein shake, a protein pudding ordered. So, you need to let us know if your patient is not consuming enough of the protein items on their tray. Number 5, a patient has a Jackson Pratt, also referred to as a JP drain, postoperatively. What is the primary purpose of this device? A, to administer medications directly to the wound site. B, to drain excess fluid and reduce the risk of infection. C, to provide a route for intravenous fluids. Or D, to keep the wound site dry. And we'll reveal the answer in about 5 seconds. If you chose B, you are absolutely correct. So the JP drain, it actually drains excessive fluid, which could also be blood, and it reduces the risk of infection. We're not having a whole bunch of bloody fluid just hanging around the surgical site. So the JP drains helps to remove the excess fluid from the surgical site, thus reducing swelling and the risk of infection. And don't forget that whenever your patient has a JP drain, you are to empty that drain once it is halfway full. Do not allow it to get all the way full. Number 6, what should you do if you observe bright red blood in a patient's drain 24 hours post surgery? A, document the finding and continue to monitor. B, increase the frequency of drain emptying. C, notify the nurse immediately. D, remove the drain and apply a new one. Yes, everybody. Yes. So proud of you. It is C. Notify the nurse immediately. Bright red blood could indicate active bleeding. And so this is a day after surgery. There shouldn't be bright red blood. It could be maybe a darker blood, sometimes blood that is kind of a yellowish color. That could be like serosanguinous, but it shouldn't be bright red. If you see bright red blood, that is a medical emergency that needs immediate attention. Question number 7. A postoperative patient is experiencing constipation. Which intervention is most appropriate to help relieve this condition? A, administer a laxative. B, increase dietary fiber and fluids. C, encourage the patient to walk frequently. Or D, decrease the patient's food intake. Hi, Jerlene. Your post-op patient is constipated. What would be something a CNA could do? And if you chose B, you are correct. So C isn't wrong, but for this one, B was the most appropriate. Because if we get them up and we walk them, however, we fill them up with proteins, we don't give them enough fiber and fluids, they're going to become constipated even though they are up walking. So what a CNA or a patient care tech can do is you can help manage constipation or bowel mobility from, of course, movement, but also by the foods that you get out of the pantry and serve this patient. Number 8, how often should you reposition a bed-bound post-operative patient to prevent pressure sores? Is it every 2, 4, 6, or 8 hours? And I know everyone's going to get this right. There's no reason for you to get this one wrong. Yes, it's every 2 hours. So the correct response is A. More frequently if the patient complains of pain or if their vital signs start to increase, which could be an indication that, they may be nonverbal, they may be sedated. But if that heart rate's going up and that blood pressure's going up, that could be a sign the patient is in pain and needs to be repositioned. Number 9, which of the following is a sign of infection at a surgical site? A, increased warmth and redness. B, decreased drainage. C, bruising around the area. Or D, itching at the site. I am so proud of you all. So, bruising could be normal. After my surgery, I was extremely bruised, but I didn't have an infection. So, bruising after a surgery is normal. So, it wouldn't be C, but that increased warmth and redness, A, could be a sign that the person has an infection. So, you and your nurse will be monitoring that to see if it worsens and to see if, with the vital signs, if the temperature starts to change. 10, a patient who is post op day 2 from abdominal surgery reports feeling nauseous and has vomited once. What is your best response? And this one's going to be easy. Is it A, offer the patient clear fluids? B, encourage the patient to walk around? C, report the symptoms to the nurse? Or D, provide the patient with a cool compress? Can't trick one of you. Very good. Somebody who's had an abdominal surgery is vomiting. I need for you to report those symptoms to the nurse because that could be sign of a complication such as a bowel obstruction or an ileus. And what an ileus is when, due to sedation, due to lack of mobility, the intestines, the bowels, they stop moving. They go to sleep. So the person won't be able to pass gas or pass fecal matter. And so if they are vomiting, if it can't go out one way, unfortunately, it can start coming up and out the other way. So if your person's vomiting after surgery, please let your nurse know. And on the image here, it gives different types of bowel obstruction, such as a herniation and adhesions, which are scars after repeated surgeries. Number 11. Number 11 states you are assisting a postoperative patient to ambulate for the first time. What is the best initial step to ensure their safety? A, encourage the patient to get up quickly to build confidence. B, assist the patient in dangling their legs over the side of the bed first. C, provide the patient with a walker or cane immediately. D, call for additional staff to assist with ambulation. I see a lot of D's and I kind of sort of agree, but this person, if they're walking after surgery, they must have an order from a doctor. They've already been assessed by the nurse, they've been assessed by the physical therapy. So it may be your first time walking with them, but it's not their first time walking after surgery. So you can call for additional staff, but to keep that patient safest, you shouldn't even stand them up without first dangling their legs over the side of the bed, because if they're going to have any dizziness, we need to know this before you stand them up. So calling for help is fine, but always let them dangle on the side of the bed. Just sit up for a few moments before you stand them up. And so dangling the legs over the side of the bed helps to prevent orthostatic hypotension or blood pressure decreasing with the changes in position. And it ensures that the patient does not become dizzy or lightheaded. So, regardless, you can have 3 people with you. You sit the person up first to see how they feel before you stand and walk them. Number 12, a patient is on a clear liquid diet post-operatively. Which of the following items is appropriate to offer? Is it milk, apple juice, mashed potatoes, or red colored jello? And I haven't eaten lunch, so all of that sounds really good right now. But your patient just had surgery. Which of these would be acceptable on a clear liquid diet? Yes, everybody. Yes, it's going to be B. So, clear liquids include items like apple juice, clear broth, and I put red jello intentionally. Do not give a post operative patient red jello because if their stomach doesn't digest it when they have a bowel movement, it's going to be red streaks in the toilet. I had literally, you're going to be calling me into the bathroom saying, Eunice, the patient's bleeding. And I have to go in there and jiggle whatever it is inside the toilet to see if it's jello particles or if it's actual blood. So after a surgery, the whole time they're in your hospital, don't give them red jello. They can have green jello, orange jello, yellow jello, but technically jello is considered clear liquid. All right, and so we're going to continue going, but don't forget to like, share, and subscribe our videos. Our website is fltraining.com. And if you all are not watching us on our YouTube channel, we would love for you to join us. I know some of you are watching us on X and you're also watching us on Facebook Live. So let's go to question number 13. What is the primary purpose of sequential compression devices, SCDs, in a post-operative patient? Is it A, to relieve pain, B, to prevent deep vein thrombosis or DVT, C, to improve sleep quality, or D, to promote wound healing? Don't stress, Anna. You're going to do fine. No reason to stress over this exam. The exam is probably going to be so easy because you're on here studying questions a bunch. So take a day off, get some rest. Don't study for a day and then go back and study again. Give yourself a break. And for everybody who is choosing B, you are absolutely correct. So SCDs help to prevent DVTs by promoting blood circulation in the legs, thus reducing the risk of blood clots. So those are those wraps that you put on their legs and they have air flowing through them and they keep the blood circulating in the legs, but you have to remind your patients not to cross their legs. In addition to not crossing their legs, ask them to pump their feet about every hour. So that way, like the gas pedal movement, that way they're helping to increase circulation and decrease their risk of getting blood clots. Number 14, if a patient's surgical dressing is saturated with blood, what should be your immediate action? A, remove the dressing and apply a new one. B, reinforce the dressing with more gauze. C, elevate the patient's head. Or D, notify the nurse immediately. I know you can't see me, but yes, 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 it is D. You all are some excellent caregivers. So you're going to notify the nurse immediately because a saturated dressing may indicate excessive bleeding. So we do expect some bleeding after a surgery, but if that dressing is totally saturated, that means it's bleeding a little too much. That requires immediate assessment and intervention by a nurse who will then notify the physician if we can't get the bleeding under control. Number 15, a patient reports severe pain 4 hours after surgery despite receiving pain medication. What is your best action? A, offer the patient an ice pack. B, reassure the patient that this is normal. C, notify the nurse about the patient's pain. Or D, encourage the patient to rest quietly. So, as a CNA in the hospital, as a patient caretaker in the hospital, you have so many responsibilities. And one of your responsibilities is monitoring that patient and letting the nurse know when something is beyond your control. So if this patient is still complaining of pain despite receiving pain medications, you need to notify your nurse. Severe pain despite medication can indicate complications such as internal bleeding or infection and requires prompt assessment by a nurse or a doctor. So once you call me into the room, I'm going to be like, okay, Miss Mary, you're still having pain. Let me listen to those bowel sounds. Let me do an assessment really quickly. Let me take your blood pressure. And if everything's okay, I'm going to get Miss Mary up and she's going to go for a walk because you know why she's still having pain? Because she needs to pass gas. So sometimes if they have gas pains, it cannot be fixed with medication. They need to go ahead and expel that gas, and walking will help them do so. Question number 16. You are monitoring a postoperative patient who has had abdominal surgery. The patient reports a sudden onset of severe abdominal pain and has a rigid abdomen. What could these findings indicate? Is it urine retention, hemorrhaging, infection, or all of the above? I see the answers coming through. Yes. So that's why that nursing assessment is so important. Future nurses, assess your patients, touch them, use those fancy Lippmann stethoscopes that you wear around your necks because when someone post operatively is complaining of abdominal pain and the stomach is rigid, it could be internal blood bleeding, but it also could be that this person is retaining urine. So, inflammation, infections, hemorrhaging, blood flow blockages, obstructions, perforations, and urine retention can all cause acute abdominal pain. So, if we don't do an appropriate assessment, this patient could be going to surgery versus having a urinary catheter inserted. So, do those assessments, my future nurses. Number 17, a postoperative patient is receiving oxygen therapy via nasal cannula. What is an important aspect of care for this patient? A, increasing the oxygen flow rate if the patient feels short of breath. B, ensuring the nasal cannula is positioned correctly and monitoring oxygen saturation levels. C, removing the nasal cannula during meals, or D, turning the oxygen off when the patient's sleepy. Remember, for this test, you are a CNA or a patient care tech. What are you allowed to do? What would be the best use of your time to assist this patient if they have on a nasal cannula? So we don't remove the nasal cannula during meals. They can still eat. The oxygen is flowing through their nose. We don't do A because oxygen is a drug and a CNA cannot change the dose of a drug, aka change the rate of the oxygen. So if you chose B, you are correct. You're going to ensure the nasal cannula is positioned correctly. Some of these patients have the nasal cannula. It's kind of like how when people wore a mask during the pandemic and it was never covering their nose. People will have their nasal cannulas everywhere except for in their nostrils where there should be. So proper placement of the nasal cannula and monitoring of the oxygen levels are essential to ensure the patient is receiving the adequate oxygenation therapy and to prevent complications. So if the oxygen saturations are, around 94% with oxygen, your nurse may not be as concerned, but with oxygen, if the saturations are dropping below 94%, you want to let your nurse know before they get closer to 90%. We can always change devices. We do not have to keep someone on a nasal cannula. And then sometimes, especially after surgeries, these patients could still have some sedation in their system and they might require some Narcan. Question number 18. A patient is on post-op day 1 from knee replacement surgery and is scheduled to begin physical therapy. What is the main goal of starting physical therapy? Is it A, to minimize pain from the surgery? B, to increase muscle strength and prevent blood clots? C, to ensure the surgical site remains clean? Or D, to allow the patient to rest more comfortably? And I am so proud of you all. So many of you all are getting the right answers. I hope this motivates you and encourages you so that when you take your CNA exam or your nursing test, to know that you can do it. And for all of you who have selected B as in boy, yes. So early physical therapy. I literally, you have surgery today. You're walking today. So early physical therapy helps to improve muscle strength, range of motion, circulation, breathing, and it helps to prevent complications such as DVTs and to enhance the recovery. So literally, as soon as you wake up, we're going to have you sitting up or walking. You can't stay in that bed all day. Number 19, you are assisting a post-operative patient with ambulation for the first time. The patient becomes lightheaded and dizzy. What should you do first? A, encourage the patient to continue walking slowly. B, have the patient sit down immediately and call for help. C, offer the patient a drink of water. D, apply a cold compress to the patient's head. Your exam is on Thursday, Cleo. I am praying for you. I know you're going to do well. So, yes, everybody, you're walking your patient with the gait belt and they start feeling dizzy. You do not hold this patient upright. I had a CNA that I knew of. She was maybe 120 pounds and she was walking someone who was 300 pounds, and she tried to break his fall. He broke both of her kneecaps. So the patient fell on top of her and her knees went and her legs went behind her. And so she had to have surgery and she couldn't walk for a while. So if a patient is feeling dizzy, I don't care where you are in the hall, get them to the floor as safely as possible. Sit them down, scream for help. Do not try to hold someone up who is falling, because they're going to fall on you. And now we have two injured people. So if a patient becomes lightheaded and dizzy during ambulation, it is crucial to have them sit down immediately to prevent falls and injuries, and to call for assistance to assess the patient's condition. So now that we have this patient on the floor and you're screaming for help, believe me, we're all coming. We're running down the hall. We have wheelchairs. We have Hoyer lifts. We can help get the patient off of the floor. And plus, this was not a fall. You assisted the patient to the floor. Had you continued to stand them up when they were dizzy, that would have been documented as a fall. Number 20, a post-operative patient has an order for continuous pulseoxymetry. What is the primary purpose of this monitoring? A, to monitor the patient's heart rate continuously. B, to measure the patient's carbon dioxide levels. C, to ensure adequate oxygenation and detect hypoxia early. D, to check for proper placement of the IV line. Why do we put that probe on the patient's finger? What are we monitoring? And if no one else has told you today, I want to be the first to say, I love you. And you're very, very smart, because you all chose C. You knew that the pulse ox was to ensure adequate oxygenation and to detect hypoxia early. And so this is our conclusion, you all. You did such a great job. So I hope that the nursing assistant practice exam today actually just reminded you of some of the safety protocols, especially as it relates to taking care of those patients who are on a medical surgical unit. So either they have a medical condition or their medical condition has caused them to need surgery. And so having a good CNA, having a good patient care tech not only saves the patient, it saves the nurses and the doctors too. So again, this is Nurse Eunice with Florida Training Academy. And you didn't miss 20. I think you missed number 20 is what you put there, Fanny. You're such a great help. And for those who have their tests this week, next week, whatever week, I know you're going to do great. Keep studying. And I'll be back on first thing in the morning at 6 a.m. because I have a busy week. And I'll be back with another practice exam for certified nursing assistants. And so again, Nurse Eunice, fltraining.com. Yes, one of my competitors right here on YouTube has changed their their website to mimic my website. But fltraining.com is where Nurse Eunice will be found. So you all have a great day and keep taking care of our patients and each other. Until tomorrow at 6 a.m. Bye.